Hi everyone, welcome back in the Hematology Bleeps. My name is Dr. Amir. I'm the Hematology Registrar from Huddersfield, Royal Infirmary, United Kingdom. Today's topic is lymphadenopathy or lymph nodes. We receive calls from different medical departments or surgical departments that they have done a CT scan or MRI scan or ultrasound scan for their patient, and it shows lymphadenopathy. So this may be a lymphoma. So can you take over this patient or discuss the patient in your hematology MDT? So, whenever there is no confirmed diagnosis of lymphoma in a patient or lymphoproliferative disease in a patient, hematology usually do not take over the patient because lymphadenopathy have a lot of other causes as well, and it is better to exclude the other causes of lymphadenopathy in the patient. This patient may not have hematological cause for lymphadenopathy. Maybe other non-hematological causes of lymphadenopathy may be present. What are the other non-hematological causes of lymphadenopathy? For example, if someone has infection, you may have noticed that with a sore throat or pharyngitis, we usually get lumps, painful lumps in our neck. So these are lymph nodes, and this is lymphadenopathy. With chest infection, severe chest infection, we usually get lymphadenopathy in our chest. So this does not mean that the patient has a lymphoma, or if the patient has any abdominal infection, peritonitis, or abdominal abscess, etc., pelvic abscesses, etc., we get lymphadenopathy in the abdomen and lymphadenopathy in the groin areas as well. So this does not mean that these lymph nodes are malignant and this patient has a lymphoma or other lymphoproliferative disease and they should be dealt by the hematology team. This is not the way. If you think that this lymph nodes are malignant, then the radiology report must say that. When you do imaging for your patient, CT scans for the chest or pelvis or abdomen, and it says that there is lymphadenopathy in the patient, the radiology consultant always mention that whether these lymph nodes are suspicious looking or not, whether they are suspicious for any malignancy or not. And then they give their comments that they can be biopsied or cannot be biopsied. If they are suspicious looking, they usually recommend lymph node biopsy for the patient. And if the lymph node biopsy shows lymphoma or other lymphoproliferative disease, then yes, hematology usually take over the patient. Infection can be bacterial, viral, or fungal. All of them can lead to localized lymphadenopathy. Secondly, another cause of the lymphadenopathy is the inflammation. If a patient has sarcoidosis, or if the patient has SLE, or if the patient has rheumatoid arthritis and there is acute inflammatory attack in the patient, exacerbation of the underlying disease, then yes, this patient will have a lymphadenopathy as well. This does not mean patient has cancer. So infection and the inflammation, they are the commonest causes of reactive lymphadenopathy in the patient. Other causes of lymphadenopathy in the patients are solid organ cancers as well. If a patient has a background history of any lung cancer or pancreatic cancer, yes, it can involve the lymph nodes as well. Okay, so metastasis can appear in the lymph nodes as well. So it does not mean that the patient has now two cancer, pancreatic cancer with lymphoma or lymphoproliferative disease, or lung cancer with lymphoma or lymphoproliferative disease. Two cancers are possible, but the point is that the radiology will always guide you because they are seeing the lymph nodes. They know whether this lymph node is suspected for having cancer or not. If yes, then we have to request the lymph node biopsy And the biopsy result will tell you whether this is the metastasis, or this is the infection, or this is the new diagnosis of lymphoma in the patient, or lymphoproliferative disease in the patient. Very rarely, drugs, especially the anti-epileptic drugs, can cause a reactive lymphadenopathy in the patient as well. So these are the few common causes of the lymphadenopathy in a patient, like infection, inflammation, solid organ cancer, and rarely drug induced as well. If the cause of the uh, lymphadenopathy is hematological cancer, then the patient usually have some specific symptoms which are called B symptoms. Patient will have patient will have weight loss, they will have night sweats, their appetite will be low, uh, and they will have lymphadenopathy and loss of energy, etc. So these are the when these symptoms are present, all of them or few of them, they are present in the patient with lymphadenopathy, then yes, then we get suspicious that maybe this is related to lymphoma, or a non-hematological cancer like a metastatic disease in a patient. Um, so both possibilities are there. Because we mentioned that solid organ cancers can also present initially in the lymph nodes as well, in the form of metastatic disease. Like patient may have lung cancer with metastasis in the mediastinal lymph nodes. This is possible. Okay, so if the patient um, lymphoma or lymphoproliferative disease involve the bone marrow as well, which produces blood cells, then the white cell count of the patient will be high. Okay. But in half of the patient will have lymphadenopathy, but full blood count will be normal. But in some cases, the full blood count shows high white cell count, which the hematology doctor can see under the microscope, and they can tell you whether there is any suspicion of lymphoma or not. If it shows large abnormal lymphocytes, then the hematology doctor will tell you this is likely lymphoma. Okay, we are taking over the patient. If the blood film does not show anything, then they would advise you to please call the radiology consultant and ask for the lymph node biopsy, if any of the lymph node biopsy, if any of the lymph node can be biopsied or not. So once disease is confirmed on lymph node biopsy that this is a lymphoma or hematological cancer, then we take over the patient. If the bone marrow is involved as well, then the white cell count is usually high, and we find out that this is hematological disease. Then we do not wait for the lymph node biopsy. Then hematology usually take over the patient. So the main message here in this video is that lymphadenopathy is not always cancer related. It can be because of the localized infection, it can be because of the inflammation. Rarely, drugs can also lead to lymphadenopathy as well. And the cancerous causes of the lymphadenopathy will have B symptoms like weight loss, night sweats, loss of appetite, pallor, or loss of energy. Uh, and malignant causes of lymphadenopathy will have these symptoms because malignant causes are two: hematological and non-hematological cancers. So any solid organ cancer with lymph node involvement will have the same symptoms as well, and plus the symptoms of the solid organ which is involved. And if it is a hematological cancer, sometime blood is involved or bone marrow is involved, the white cell count is high, we can see the abnormal lymphocyte in the blood film. But sometimes the bone marrow is not involved, it is only the lymph node which are swollen, and patient has B symptoms. Then we always ask the medical team or other teams to discuss with the radiology and please arrange biopsy for the patient. The biopsy report may show hematological cancer like a lymphoma or lymphoproliferative disorder, or it may show a non-hematological cancer, for example, metastatic disease in the biopsy report. Then the oncology has to take over this patient. So thank you very much. When you have a CT report or a patient with lymphadenopathy, always think about the reactive causes. Young patient, 20-year-old male patient with sore throat and lymphadenopathy. This is not cancer; it is secondary to sore throat. If a patient same patient has cough as well, and you do chest x-ray for the patient and it shows mediastinal lymphadenopathy, most likely it is related to the lung infection. But if the patient has any B symptoms like weight loss, night sweats, or a loss of appetite, or pallor, lack of energy, then you need to discuss with hematology, then bleep us. And in case uh, you are not sure about any question, bleep hematology. Thank you very much.